Hello, I'm Dr. Adam London, Director of the Kent County Health Department. And let me tell you, we are getting a lot of questions right now about the availability of vaccine for our youngest kids, those kids under the age of 5. And I'm one of those parents who's very eager to have that vaccine available. We have a 3-year-old at home, and we'd very much like to protect our child and the rest of our community as much as possible with vaccine. So I'll talk a little bit more about that timeline in just a minute. But first, let's talk about our numbers. And right now, we are continuing to see improvement with our new cases and the situation regarding COVID in our community. A couple of weeks ago, we were seeing well over 1,000 new diagnosed cases per day. It's a surge largely driven by the Omicron variant, which is more contagious. Lately, we're seeing less than 600 new cases per day. We've also seen that positivity rate come down a bit. A few weeks ago, we were over 40%. Now we're less than 30%. So that's trending in a great way as well. And most importantly, our hospital numbers are starting to improve. A few weeks ago, we were over or near 400 COVID positive persons inpatient in our local hospitals. A lot of those folks were on ventilators and are really struggling. We're now seeing that number is closer to 300, in fact, a little bit less than 300, and fewer people are in ICU and on ventilators as well. So that's a lot of improvement. We're still a bit concerned about the number of kids who are at Helen Voss Children's Hospital. For most of the pandemic, we've hardly seen any at all, and very few on ventilators. During the past few months with the Delta surge, and then with the Omicron surge, we have seen more of those younger children affected. Right now, we've been averaging between 20 and 30 kids at the Children's Hospital that are there because of COVID, and we've seen 7, 8, 9 at a time on ventilators. So we still want to see that situation improve and those numbers come down, but overall, our situation with COVID is improving at this time. And we really hope to make vaccine available to those youngest kids. And so that's the question that many people have had is when will vaccine be available for those youngest kids? So on Tuesday of this week, the company Pfizer submitted their clinical data to the FDA. On February 15th, the FDA has an advisory panel of experts in medicine and pharmacology and other professions that review those data and will make a vote and a recommendation to the FDA leadership about whether or not to approve that vaccine for those younger kids. Assuming that happens, that recommendation then goes to the CDC. They have an advisory panel that reviews it and makes sure that it makes good public health sense, and they make a recommendation to the director of the CDC. So there are a number of steps that have to happen, but thankfully, those steps have happened pretty quickly, in pretty quick succession with the previous processes of approval in the past months. So we're hoping that if everything goes well, we could have a recommendation and approval by FDA and CDC by the end of this month. Now, of course, we also then need to move vaccine in whatever doses are recommended to pediatrics offices and other providers in the community. So that may take another week or so, but we're optimistic that by the end of this month or early March, that vaccine may be available to those youngest kids. So that's great news, and our improving numbers are great news, but still a reminder to everyone, people are still getting hurt by COVID-19 in this community. And even though those numbers are coming down, the reality is that it's still here with us. So please continue to do what you can do to make it less likely that you and your loved ones are going to be impacted by this. And stay healthy, stay positive, and I'll talk to you again very soon. Thank you.